It's really a matter of great pleasure to be with you, because I always believe that at the time of conference, we come across so many friends and revive our past memory, which gives us a feeling of pleasure of living a life. With these few words, today what I am supposed to do is, which is unlike an interventional cardiologist, because I know as an interventional cardiologist, probably I have a slide from one of the, I think it was from Pescher. He said that if you are a man of medicine and you start knowing something, then you will distance yourself from God. But you when become a master in your profession, you realize that you need God. So with these few words, I am presently also holding a position in the WIMS hospital. A word about the WIMS hospital, that it is created by the doctors. It is managed, funded and totally managed by the doctors. So I, on behalf of the WIMS Parivar, I request all of you, it is just opposite the Motera pavilion. So whenever you are on that side, you can always visit, call one of us, and we will be happy to share how a doctor should run a full-fledged hospital. Today's topic is, you see, prevention of heart problem. And why? Because you see, time and again, we come across this kind of a news that suddenly one of our colleagues had passed away. And in the background, you see, this was a statement which I read a couple of years back by one of the IMA president, that an average Indian lives up to 69 to 72 years of life, whereas a doctor's lives only up to 55 to 59 years. See, it should be other way around to my logic. But as a doctor, we should know better about the physiology, about the human life, about the heart, about the everything of the life. But still, we live 10 to 12 years less than an average Indian live. Why? Why there is a disparity? It's an obvious disparity which has to be addressed. There is something which has to narrow down this gap, or at least we should live longer than an average Indian lives. That is what my philosophy and the objective of this today's discussion. You see, heart, like many organs in the body, is in an invisible wonder. Why I say it so? So in a resting time, it pumps nearly 2.5 liter of blood throughout our circulation. But the God has given it so much reserve to the heart that in 1 minute, it can pump nearly 15 to 18 liter blood in the circulation. And what is the length of our circulation? Can anybody say? It is nearly 1 lakh kilometer. The distance of the total length covered by the arteries, the veins, the capillaries on the arterial side and the capillaries on the venous side, if you put together, it comes to nearly 1 lakh kilometer. So 1 lakh kilometer is supplied 18 liters of blood every minute if it is required. So how much is the reserve potential of a heart, and how we can allow it to get suddenly collapse? So probably my perception is that it is in our hand. And the commonest cause for this kind of a sudden catastrophe is a myocardial ischemia, arrhythmia, or what we call is a sudden cardiac death. And what happens? You see, the God has given us the arteries like this. You see, it is an artery which is fully clean. Yeah, it's here, sorry. It is fully clean. But what happens as we spend time in the life with our diet and habits, there is a deposition, and the deposition then get accumulated. It leads to a plaque. The plaques becomes long for a longer duration, gets calcified, becomes vulnerable, rupture, attracts the thrombus, and leads to a clinical event of a sort of a acute coronary syndrome. And that is how what happens. So it is not that at any point your artery may be, it cannot be prevented. It can be prevented right from the beginning or even if you have developed a recent myocardial infarction. The nature is so generous. આપણે ગુજરાતીમાં કહી છે ને, જાગ્યા ત્યાંથી સવાર. We may be at any point of time in our arteries, but nature is very kind. So we have to follow those steps. The primordial prevention is one where there is no risk factor, but you start adopting such lifestyle. Like, I will just give you a small example. When I was very young, I must be in 4 or 5 or 6 years, but my grandmother used to tell us one thing. Tarun, daru na pivai. Somebody in our neighborhood was taking wine. So it's so deep rooted in my mind that I have never tested wine. So this is what the primordial prevention, something which comes from your family, from your parents, from your surrounding, which helps you build up such habits that you will not land up into these kind of problems. So that is the primary prevention. The beauty of the primordial prevention is that once that habit is adopted by a subsection of a society, there will be a great massive impact of prevention. Like say, I give you an example. આપણે ત્યાં દાખલો એવો એક આમ વન રખ્યો રિવાજ હતો, ભાઈ 11 કરવી. હવે 11 આપણે બધું જુદું જુદું ખાવા માંડ્યા. But I had a discussion with one of our saint. The concept of doing 11 was to prevent a surge in your cholesterol, surge in your sort of a sodium level, which is happening near either the full moon or no moon. Because they have derived that at those period of time, the chances of developing vascular complications may be much more. So so many, I would say, the customs had some science, but because of the time delay, we have not been able to continue these kind of things. Second is that when you develop a small symptoms, like say occasional angina, your TMT is positive, and you start taking precaution, it is your secondary prevention. And when you have a clinical problem, and you start taking the precautions, it is your tertiary preventions. So at any point of time, we should do a preventive steps. There is a misconception in mind of laymen, as well as I have come across so many times the doctor, Sahib, hamara family ma chhe. That's okay. So your genes load the gun, but the trigger has to come by the lifestyle, by the diet. So it is in your hand whether you want to really put the trigger to the fire or elevate the catch of the trigger. It is in your hand. So prevention is, I'm sure each one of us knows, I'm just making a repetition. Diet, lifestyle, physical activity, weight reduction, stress management, avoiding the bad habits, and preventive checkups and awareness. I think it sums up the steps of preventions. You see, one of the commonest problem in an affluent society is an overweight. And the lifestyle leads to so many problems. I'm sure some of the speakers who are coming in the 2 days' time will touch upon these areas. But there are so many diseases which are affected by your lifestyle, is obesity, diabetes, hypertension, coronary artery disease, osteoporosis, dyslipidemia, depression. This is some of the major things which I have enumerated. And now it is proved that the obesity leads to a manifestation of such disease, even if you may not have, like say the dyslipidemia, depression, osteoporosis. And in the developed countries, the studies have been conducted which has shown that the obesity increases the relative risk. Like say these are the moderately increased risk is coronary artery disease. Obesity also increases the risk of diabetes. And diabetes, once you have, it increases the chance of coronary artery disease. Today it is believed that once you have a diabetes, you are likely to have atherosclerosis anywhere in your body. Coronary artery disease today is being believed a disease of metabolism. Is not believed to be a disease of vessels. It is a bystander. So there is a lot of we have to do for prevention of obesity. And the root cause of the obesity is lifestyle. Today only I came across in the morning at one of our OPD, One fellow came, he is a IT expert. He is serving somewhere near Bangalore. He says that for last 5 years, my lipid profile is highly abnormal. You see, his LDL is more than 240. I asked him, you are a IT professional. How do you manage your day? So he says that I'm an IT professional and I need not go to the office. So I manage from my home, from my laptop. And what about your food? He said, I order on this thing, the Zomato or other things, they serve it. So he hardly goes out. He hardly moves. You see, no exercise. So no wonder that his cholesterol is going to be abnormal. So lifestyle is very important. We have to look upon it. And second thing is the society in which you are brought up. You see, the approach to the physical activity is lacking. We believe that the more you take the rest, it is better. You see, the misconception is when the child is born and he is of average weight, what the others, neighbors, when they come to look, see the child, balak jado nathi, it's not always a better. You see, there's a wrong conception. So our scenario, our way of looking at the issue is different. So we have to change it. And it is not that you, when you are overweight, if you reduce your weight, there is no benefit. This is a slide which gives you how you will classify yourself as a normal weight or by the BMI. BMI is little cumbersome, but there is a simple formula to measure the BMI, body weight versus your height in square meter, or simpler is a waist circumferences divided by hip circumference. This is very simple to measure it. So in man, it should be, these are all values for the adults. Man should be more than 95, women should be more than 80, will increase the risk. But if it is more than 102, it substantially increases the risk of lifestyle related diseases. So it is very easy when you look after yourself in the mirror, at least 30 seconds spend to look after your waist hip ratio as well. And try to take corrective steps if it is abnormal. And the benefits of weight loss cannot be underestimated. You see, the mortality, all cause mortality, if you overweight, lose 10 kg, 20% fall in total mortality, 30% fall in diabetes related deaths, there is a substantial fall in the obesity related cancer deaths, 50% reduction in the fasting glucose value just by 10 kg weight loss. So if you are overweight, you get so many benefits just by changing the way you maintain your weight. Simple, very simple. So look at your weight. It's very easy. There's no science, much science in that. You see? Second is diet. You see, that one can logically think from the day the man has started living on this earth, he has to eat. But one thing is very simple and we have to appreciate in our mind, that in adult life, everyone takes food by his own hand. There is nobody to put food in your mouth. You only select. You only make the desire. You only control what to eat, what not to eat, how much to eat, when to eat, and what is the content. So there is no excuse about the diet. It is only individual's responsibility, because in adult life, an exceptional when you are so much ill, otherwise the diet is managed by individual of his own hand. So that is must. A general guideline, overweight fellows will require less amount of the calories. Underweight fellow will require more calories. As we grow, some of us are more than 60 here. So we should realize that what we can...
Sorry for the disturbance. So there are two cards as this ground floor, GJ01WP4816 and second card GJ01WC0927. Anybody over here is having this card number? Let me repeat, GJ01WC0927, GJ01WP 4816. Nobody, thank you. Kindly proceed, sir. Sorry for the inconvenience.
No problem. So when we start growing, we should realize the change in the diet which is required. We can't continue the diet which we were taking. A word about the glycemic index. Glycemic index, as a doctor, we should know. What is the glycemic index? It's a response of the food which you take into 100 divided by the value you get after taking 100 gram of glucose of the blood sugar. So the more the glycemic index, it is dangerous. The less the glycemic index, it is better. So this is what I've just put as few things here. It's a list is long, but you see there are some dals and pulses have a lesser values as compared to the wheat-based preparations. So you have to select that. A word about the physical activity. There are a lot of things which we can discuss on the diet, but looking to this constraint of the time, the concept is more important. Physical activity, lot of benefits of physical activity. We should remember that God is not foolish. He had given us limbs basically for the activity. Otherwise, you would have created human beings with only trunk and the head. You see, He had created us with the limbs. The limbs are for the motility, for the actions. So we have to do the physical activity. And these are the benefits. The regular physical activity. You introspect your own day. How will you do daily activity of, I would say, nothing else? Don't go to the gym, but walking. 30 minutes of walking in your day you manage. And what are the advantage? You see, all-cause mortality reduced by 30%. Cardiovascular disease reduced by 35%. Type 2 diabetes by 40%. Colonic cancer 20%. Breast cancer 20%. Depression 30%. Hip fractures by nearly 65 to 70%. And dementia, the other psychiatric problem in the old age, by 30%. So the physical activity, if you start doing from early life, have only benefits, and which is what the nature has given to you.
So 5 minutes left.
Yeah. And this is a famous slide I am not going to repeat. Other things are, if you have the coronary known risk factors, respect to control them, like say if you have diabetes, if you have hypertension, but a word of caution. If you are having a heart problem, please contact your cardiologist and take an advice from him, a reliable information. Sometimes we have seen that learned doctors, they take the information from a source which has not been authenticated and they follow it. So you see, today is a time of information, but the reliability is at question. So you have to follow the advice which is given from the reliable sources and authenticated. And these all things, cholesterol, diabetes, hypertension, other risk factors, these days there is a lot of discussion about the microplastics. These are all have produced a lot of benefit if you control them. Awareness is also very important. One of the things which can be easily adopted and is available in Gujarat is the concept of coronary artery calcium scoring. This concept of coronary artery calcium scoring is mainly for prevention. If your calcium score is less than 100, then you are less likely to develop a neovascular event in next 10 years of time. But if it is 100 or more, then you have to take precautions, and which has now entered into guidelines also, that if you see the coronary artery calcium score up to 99, no need to start statin, but if it is 100 or more, at least you should start the preventive steps of taking this therapy. As similar is about the aspirin. If you have the coronary calcium score of 100 or more, and if you have a risk, well, the predicted risk is 10 or more, 10% or more, I think those individuals should start taking the aspirin for prevention if there is no contraindication. But although all of us, I am sure you are aware about this, but there are a lot of barriers to the preventions and which we need to break. You see, some of the barriers are loss of awareness. The wisdom tends to grow in proportion to the one's awareness of ignorance. The more ignorance we remove from our mind becomes better. Overconfidence. Many doctors, they feel that I never get this. So this is overconfidence. You have to get it checked. Denial. Once you have been diagnosed, just somebody was telling me, somebody had a discomfort. He said, now here. And next day he died. So denial to the symptoms which his body is telling. Yes? Depression. People become depressed after knowing something abnormal in the body. There is no need to get depression. We have to take a corrective steps. Carelessness. We don't respond to what is required. Lack of adjustability. Suppose you develop a myocardial infarction. You got treated. Don't get perturbed that why did it happen. Get it changed and get adjusted to the new environment. And be honest to yourself. See, one of my friend, he was telling me that I am daily going for a walk with my cub. And this is what he was doing. So he was not honest to himself. He has to be honest. A doctor has to be honest to himself to punctually carry out the measures which we have enlisted. And the difference between being a poison or the beneficial drug depends largely on the dose of the agent. The same applied to the food also and to the drugs also. In case you have some heart problems, take drugs judiciously under the supervision of your colleague. See, when I look at our heart, you see the heart is the only organ in the human system which lives longer than our lifespan, because it starts beating from the 5th week of the gestation of a person and dies when the man is declared dead. So our lifespan is from our birth to our death, but the lifespan of the heart is longer than our lifespan. So such a wonderful creation of the God, we just sometimes spoil it without taking proper precautions. So if you don't fight for what you want, then don't cry for what you lost. Thank you for your attention.